As the pregnancy progresses, the volume and weight of the belly increase. The pregnant woman will feel more and more tired and uncomfortable as the expected due date approaches. The woman will have trouble sleeping and resting at night, in addition to noticing pelvic pressure as the baby becomes engaged. Once reaching the 34th week of pregnancy, it is normal for the woman to experience some of the following discomforts: feeling of suffocation, dizziness, gas, slow and heavy digestion, uterine contractions. In addition to all these symptoms, the woman may present a condition called intercostal neuralgia. This is a sharp pain caused by the pressure exerted by the enlarged uterus on the nerves in the rib area. It is recommended to apply heat, as well as to be mindful of posture when sitting and not to remain seated for long periods.